The new cases are surging again in Utah at a pace we have not seen since last fall.
Doctors at Intermountain Healthcare say the rise continues to be driven by the Delta variant among people 40 and younger who are not vaccinated. News specialist Jed Bolt joins us with the latest concerns. Jed?
New COVID cases, hospitalizations, and positivity rate are all rising this week. It's the kind of surge that healthcare workers saw last year, but the patients are younger.
We are in a very similar place as we were last summer.
The virus is spreading rapidly, and intensive care units at Utah's hospitals are either full or filling quickly with COVID-only patients.
Over the last few months, where we've been able to care for patients of many different types of conditions.
Dr. Brandon Webb, an infectious diseases physician at Intermountain, says that reflects the high level of COVID transmission during the past few weeks.
We expect that the hospitalizations that we're seeing now will unfortunately just continue to increase.
He says local restrictions like masking, social distancing, and limiting gatherings may be necessary again to truly slow the transmission of the virus unless vaccinations pick up. Last fall and winter, it was the elderly and those at high risk who ended up at the hospital. Today
has really been replaced by a population that is largely unvaccinated and younger. We're seeing patients in their 30s and 40s.
Taking a toll on healthcare workers.
I just talked to an ICU physician yesterday who was expressing exhaustion.
Frontline caregivers who have borne the brunt of the pandemic are struggling with the reality that the hospital will be full again.
The pandemic has taken its toll emotionally and psychologically on all of us.
Dr. Webb says that there's a feeling among healthcare workers that the community has given up on the healthcare precautions that made a difference last year. They're now asking everybody to get vaccinated. For KSL 5 News, I'm Jed Bolt.